Raul Grijalva, I believe I pronounced your last name correctly, Representative, and if I didn't, please correct me. You're co-chair of the House Progressive Caucus. Your sense of the extent to which the White House is using backroom deals, whether it's in the car deals with the GM bailout, what we're seeing with this reporting on the drug companies now, or some of the behavior with the banks in the past and potentially in the future. What is your sense of how much of our policy is being made in private and how much is being debated in public?
Well, you made a good point earlier in your program about the fact that part of this debate, it should be a healthy debate based on facts and based on trying to reach an accommodation with each other that produces a product that is good for the American people in terms of health insurance. And while we stumble along and do our dance to try to get to some place that is agreeable, we discover that there's already been a decision made as to what that compromise is going to be, and the involvement of the Congress is non-existent or limited. For example, if cost containment and affordability for the American people is one of the cornerstones of moving health reform forward, then all avenues should be open. And yes, Pharma said $80 billion of future profits would be on the table to help with that cost containment. They did very well in the subsidies they received from the federal government under Part D and the prescription. They did very, very well on that. And so we're saying, why not bulk purchases? Why not bulk negotiations? Why not importation that can help drive those costs down, make it more affordable for the American people? And so if you take that huge ability to deal with cost containment off the table, then we're left with what? We're left with either reducing benefits, reducing subsidies for people that need it the most, and constricting eligibility. So the goal of all Americans having access to health care is now compromised. And you know, what do those deals mean? I agree with the Speaker and with Chairman Waxman. Those we don't feel those are binding to us.
Yeah, well, and understandably so. I guess my question is, what is your sense of how much, for not just health care, even though that's the most obvious and pointed example right now, but what is your sense of the White House using back-channel pre-deals to try to get conversations basically pre-baked and then sending them to Congress?
Well, I think it's the proverbial cart before the horse. I think that part of the debate process has to be the transparency of what we're doing. The American people are going to be supportive. They're going to understand shared sacrifice. They're going to understand all these concepts if they feel that their elected representatives are part of that process.
Yep.
If we feel locked out, they're going to be their sense of support is going to be lost.
Understood.